Hi guys, in this video we shall talk about the management of hemorrhoids, that is the management that you can do in your home. So if you're having hemorrhoids, you're having pain, you're having blood coming out in your stool, streak of blood is seen, you will be having pain. So hemorrhoids is known as piles. So whenever you're having hemorrhoids, please make sure that if this hemorrhoids is not resolved within a week, you should immediately go and get it checked by a doctor. Which doctor? You should go and meet the general surgeon. They are specialists in this, right? Specifically, if you can go and meet your GI surgeon, it's much better, right? So if you're having hemorrhoids, so what is the treatment that you can do at your home? Obviously, if you're having hemorrhoids, if you have the convenience and you can go to the hospital the day you experience pain, is the best, right? If you're around 60 years or more than 60 years and the blood is coming out in your stool, it can suggest that you might be having cancer of your colon or around your rectum area, right? So 60 years, obviously once you hit around 60 years, the chances of cancer, it definitely goes up as compared to having cancers in young adults. Obviously there are some cancers which is more common in small kids, but the average adult age, the chances of cancer are relatively less as compared to the extreme age. 60 or more, high chance of cancer. So that is the reason you should be more cautious. So talking about the management of hemorrhoids, what is the management that you can do at your home? Please, first thing first, you should be having high fiber diet, right? And stop eating your refined food. Now your flour, that is maida, you have to stop taking that. That is not going to digest very properly. And multi-grain foods, very important. Pulses which are multi-grain. And rice, if you are trying to see for the rice, don't try to go and take the polished rice. Try to take the brown rice. If not, just take the normal rice which is not polished. Simple thing. If you go and buy the rice from a village, more chance it will be more natural. The second thing that you have to include in your diet is high water intake. If you're having high water intake, there is less chance of developing of constipation. And if you're having piles and you're having constipation, your pain will be next level, because it will be so painful you cannot pass your stool. Many times the patient is passing stool in multiple episodes, and the stool has been passed in very small streams of stool is passed. The entire bulk doesn't come out, right? The next thing that you have to see for the management of hemorrhage is you have to take certain kind of medications. Now you can take over the counter drugs, painkillers. You can take the painkillers to reduce the pain. Now the second thing that you can do is something known as cis bath. What you do here is that you take a bowl, you add warm water, you can add salt, but it's up to you. If you don't want to use the salt, you can just use plain warm water and sit over that, and it should cover your entire anal canal. That should sit. So what it does, it's going to relax the muscle and it's going to help in your pain. Now this next thing that you have to do is topical application of medication. Now what is this topical? You have a lot of medication here. Now one of the very important key medication is to use local anesthetic, that is your lignocaine. It's very important. Once you apply this lignocaine, what it is going to do, whenever you're getting hurt, right, any place in your body you're getting hurt and that area has been irritated, that muscle will become in contracted state so as to give temporary support, right? Same thing happens in abdominal area. If you're having any problem in your if you're having peritonitis, if you try to see for the abdominal area, you try to press the muscle, that muscle will be tight. It is trying to cover the area. Since the area around the anal canal during hemorrhoids or piles is dangerous, the muscles will be very tense. So when the muscle is very tense, you won't be able to pass your stool. You'll be apply force and it will be going to do more trauma. Now, so once you use this lignocaine solution, you apply the lignocaine jelly into your fingertip and slowly just apply around the anus and wait for 2-3 minutes. Let it work, and then if you're having a glove hand, apply the lignocaine in your finger and directly insert it into your anal canal. If you don't have the glove thing, you are getting the attachment into the cream as well, so you can apply that on the surface of the tube and then insert it. This is going to reduce the pain and also going to reduce the muscle spasm. Now there are multiple kinds of creams that are available, but the 2-3 items in the cream composition that you should watch out. Very important is lignocaine. It is going to reduce the pain. Second thing, sometimes these creams are going to contain certain kind of steroid, right? Any kind of steroid is going to reduce the inflammation. And the third thing, this thing is might be having is nifedipine. This is known as calcium channel blockers. Also is going to relax the muscle. So if lignocaine is a must, and nifedipine, if you are having nifedipine plus lignocaine combination of cream, use that. And if you can get any kind of methasone, that is your steroid, along with nifedipine, along with lignocaine, very good. So lignocaine is must and nifedipine is must. If not, if nothing is available, use lignocaine. It's going to help you to a very great extent. And also very important is that you should watch your diet, and if it is lasting more than a week, please go and get it checked. Don't take it lightly, right? So these are the things that you should watch around if you are having hemorrhoids. And just to give you a basic idea about hemorrhoids, there are mainly two types of hemorrhoids: internal and external. The internal hemorrhoids will not be painful, okay? The internal hemorrhoids that you can't see, the area will not be swollen, the blood vessel will not be swollen, so it won't be painful. But whenever you pass your stool, it is going to bleed, right? And if you're having external hemorrhoids, definitely is going to bleed, and definitely you will be having pain. So that is how you differentiate internal hemorrhoids and external hemorrhoids. Another thing that can occur, you might get confused, is hemorrhoids and anal fissure. Now what is happening in hemorrhoids is the blood vessel which is around that area is getting inflamed, right? It's getting inflamed. There's swelling of blood vessels. Whereas in anal fissure, the anal canal, there is a cut, there is tearing of the mucosa, so that is also painful. So anal fissure is painful. If you see with the help of a speculum, you will be able to see the slit. How will be the slit? Imagine this is the imagine this is your anal canal, right? There will be literally there will be cut, a tear. There will be a tear somewhat like this. You will be able to see the tear, right? Can you see the tear? There will be a tear in your anal canal. This is known as anal fissure. Anal fissure will be painful, and also external hemorrhage will be painful. Hemorrhage two types, internal and external. Anal fissure will be again. So overall, just use nifedipine, use lignocaine solution, and if you have any steroid, definitely useful. Topical, these are all application based, okay? And then you can use over the counter medication that you can take from your mouth in order to reduce the pain. High fiber diet, don't eat refined flour, and more water. And then you apply it in a warm water. If you don't want to apply salt, no problem, just use that and apply warm water and sit on it 2 or 3 times a day, around 15 minutes per episode. So 15 minutes, 15 minutes, 15 minutes, around 3 times you're going to sit in one whole day. So it should resolve in a couple of days. But if this thing is not getting resolved in 1 week, definitely go and get it checked as soon as possible. Okay, bye.